just talk about plastic surgery?
Yeah.
I'm just gonna go through all the things that I...
All right, so that was Megan Fox on Call Her Daddy spilling all the tea about her plastic surgery procedures, what she has and hasn't gotten done, and being completely transparent about it. I'm here for it, so let's unpack it. I'm Dr. Danielle Andry. I'm a plastic surgeon here in Houston, Texas. First of all, Megan was extremely open about the plastic surgery procedures that she has gotten done, but also about her body dysmorphia, her history with ED, and then also how people's perception of her has affected her mental health and how her growth through plastic surgery has kind of come full circle with that. So here's what we're not going to do. We are not going to judge or shame her for any of the decisions that she's gotten done. Definitely not going to judge and shame her for her body or how she looks, anything like that, because we are about women's positivity and about giving people, autonomy of their body and making decisions for themselves. First, let's talk about what she talks about, her initial implant size. So she says that, in Hollywood, so many women get things done. It's kind of normal, but everybody has to pretend that they didn't get things done. So whenever she initially got her breast done, she had wanted it done for a very long time, but she got more subtle, natural looking implants because in Hollywood, you can't have that done look. And so she kind of regretted not going big enough. Then she had a revision procedure after she had had her children and breastfed. What she talks about is the fact that her breasts seemed to go completely and that she didn't have that augmented look anymore. This is very, very common after people have a breast augmentation and then breastfeed. They tend to lose a little bit of that volume. Their skin has now stretched, and so that implant's sitting a little bit lower. So it feels like you've lost a lot of upper pole volume and lost a lot of fullness. So it's very common for patients to have to undergo some type of revision procedure after getting a breast augmentation and then breastfeeding. Patients are either sizing up or having to get a lift, some of those things having to do with after breastfeeding. Next, she talks about how with her next set of implants, she had a lot of rippling and visibility of that implant. Again, that can happen after you have breastfed, have lost a lot of tissue. And she said that she had very little tissue to start off with. She is a very thin woman, which gives you more prone to having rippling and visibility of your implant. I've actually seen pictures of her in photo shoots where you can see very clearly the outline and rippling of that implant. So she says that she got a revision from that and that kind of fixed her rippling. And so that can mean a number of different things, but some things that you can do in order to fix rippling. She may have had her implants placed above her muscle previously, which has more visibility of the implants. She may have gotten them switched to under the muscle. There's also things like meshes or kind of biologic mesh that you can place over it to have more camouflage of the implant. She may have gotten a higher profile or a more cohesive implant that can help with some of the rippling. So there's multiple things that she could have gotten done in that revision to help with that visibility of her implant. Then she talks about her latest implant size and that she wanted to go as big as possible. Now, in somebody as thin as Megan, there is some anatomic boundaries like the width of your chest and the height of your chest that could play a factor in how big she wanted to go. And of course, she wants to stick with something that's going to not completely mess up her anatomy. She spits a lot of plastic surgery facts in this, and you can tell that she's done a lot of looking into plastic surgery, and she actually knows a decent amount about it. So I'm sure that she wanted to stay within the boundaries of her anatomy, but still go as big as anatomically possible because she likes that fake look. Likely she kind of went with like an ultra high profile or something like that to give her that bigger look. She also talks about how this bigger implant is going to look different on her and her body type because she is so thin versus other patients who have a little bit more, body fat or a little bit more breast tissue. Everybody is going to look differently. So whenever you're coming in with goal photos of Megan Fox, remember what her body type looks like versus say your body type would look like. Also, those implants are going to look very different on her versus somebody else because of that. So I know that that's been a ton of information. I'm going to go into some of the other plastic surgery things that she talks about in that interview, but that's kind of a summary of her breast journey, which kind of mimics a lot of other people's breast journey. So I thought it was very interesting to hear about that and actually to hear her perspective, which was really good and very positive.